Thank you, and good afternoon. As we come towards the end of April, we do not shift our actions. Our actions remain constant. Our commitment remains the same, but we do begin to shift our mindset into one of preparedness, preparing for the future, preparing for changes in our way of life, preparing for an uneven recovery and rebuild, and preparing to continue to be patient in a situation that is not only ever changing, but a situation that has multiple sources of information with cities involved, counties involved, states involved, federal governments involved, all of them trying to navigate through an unprecedented situation as best as possible. And I'd like to take a minute and just talk about the general approach and mindset and things and considerations that go into account for all of the various actions that are being taken and are likely to be taken in the coming weeks and months. The simple fact is there is no perfect way to address an unprecedented global pandemic. We are trying as a county as best we can to navigate through a difficult and ever-changing situation, mindful of the dangers of COVID-19, mindful of the total impacts on public health, and mindful of the needs of our community. While we have been generally successful in flattening the curve in San Diego, in particular in April, we must continue to show meaningful progress. The governor stated today in his address that he believes the state of California is weeks, not months away from seeing easings of statewide protections, particularly those around businesses being open. But he also pointed out that we can't lose our focus now, that losing our focus now and losing the progress we've made now would imperil our ability to move forward. And so we are hopeful that the numbers continue to trend in the right direction and that we can take additional steps to ease some of the restrictions. But it's important that we all understand and keep in mind that none of this will happen all at once. It will be like a dial that turns slowly and in small steps. We take a small step, we pause to monitor the impact. If conditions warrant, then we're in a position to take another step. Our cases in San Diego County have been low compared to other areas of America and the world, and the impact on our healthcare system has been manageable. Again, a marked and stark difference between other areas in America and throughout the world. But we have to continually ask ourselves, why is it that our cases have been low compared to other areas and our health system has been able to maintain its integrity compared to other systems? It is because of the actions that we have taken. And so as we come out of this into a posture of potentially changing some of those actions, we have to be very intentional, we have to be very thorough, and we have to be very thoughtful in how, as we ease out of some of these, even with small steps, that it does not trigger a situation like we saw in other parts of the world. We have to continue to be very patient, and we are not by nature a very patient people. Both patient with the changing nature of the situation, patient with the changing sources of information, patient with the more accurate way of measuring what we are facing, along with patient in realizing that there are a lot of entities from your city to your county to your state to your federal government to your hospital system that are all involved in managing through this together. And we have to do that in a time when we're not a historically very patient people. It really is resilience that we're looking for as we work our way through these, through the challenges, through the opportunities, through each and every one of these steps, knowing that as a community we are all in this together and we are all doing the very best we can in a very difficult situation. I've been asked the question about, given coronavirus is just as contagious as it was at the beginning, how is it we could contemplate easing without expecting a significant and massive spike? And the answer is that it depends on how we do it. It depends on doing it in a way that where we change our behavior, we change our posture, we change the way that we go about life. The hope is that by greater awareness and commitment of the need to physically distance, by greater awareness and commitment of the need to wear a face covering, by greater awareness and commitment of the need for hand washing, greater awareness and commitment of what to do if you have symptoms, the hope is that by all of these things combined, the greater awareness and commitment, that as we start loosening things in the coming weeks and months, that it won't have a significant impact on our public health posture because we will be living our lives in a way different than we were in January and February. But we're not going to be able to immediately go back to everything all at once. And there is no way we can design a phasing system that addresses every concern or every question. As we take steps, they will not always be perfect. You can't take small steps, even as intentional and well thought out and meaningful as they are, and have them address every concern or every interest. But the goal is to take action. The goal is to create forward progress, but create forward progress in a way that ensures we're not compromising the integrity of our healthcare system, to create forward progress in a way that ensures it is manageable, that is achievable, that we can avoid large gatherings and we can avoid the rapid transmission and spread. And that is what we are striving to do, to take a small action, a small step, and begin forward progress. The beaches are a good example. We've said from day one that it is not only okay, but it is advisable to get outside and exercise. It's a vital part of life. You just have to do it responsibly. At the early stages of our coronavirus exposure, it was simply not possible due to the overcrowding that we saw at the beaches. And so we had to restrict and stop that. So now we're in a posture where we want to make it a little bit easier to get outdoors because we believe that the public can do it in a responsible way because of that greater awareness that I talked about earlier. Because as we begin to move into a new era, we all begin to operate in a little bit different way, in ways that prior to this, we never imagined. We never imagined a world where we would purposefully physically distance from non-household members. We never imagined a world in which we would wear face coverings. But that is the world that we are in. And it is the world that we are going to be in until such time as we have a vaccine or a widely available therapeutic drug. And so based on our general flattening, based on the integrity of our healthcare system, combined with the reality that getting outside is essential, we allowed our coastal cities at their time and choosing when they are ready to provide the option to allow people to get back in the water. But we had to do it in a measured way. We had to leave parking lots closed from overcrowding. I don't like how that limits access to our beaches. But unfortunately, the first step and phases have to be done in more restrictive ways, or we would have no path to begin moving forward. We had to limit sitting down or laying on the beach or playing group activities. Because as we just saw this weekend in Orange County, that leads to not only more people at the beach, but it leads to people staying there longer, which leads to overcrowding situations. Overcrowding situations is what has the impact negatively on our public health system. We had to not include boating because you can't reasonably physically distance on a boat. It isn't that our public health folks don't like boaters, they do. It's just that it wasn't the most appropriate first step. And this is an example that you are likely to see replicated in multiple phases as we begin the process of moving forward. Small steps, monitor the impact. If the impact is positive, then we can begin to take additional steps. If not, then we may have to pause where we are. If the impact is negative, we might have to turn the dial back. And so we ask for your continued patience and your continued understanding that as we go through this in a complex society, with a complex economy, with complex recreational opportunities, it will be difficult to navigate through, and we ask for your patience. We ask for your continued commitment and your continued understanding that the aim and desire is to see our county rebuild and recover on a slow, steady, appropriate pace that ensures the adherence to public health. The simple reality is you are not going to be in a position to rebuild an economy until you have customers that are comfortable going out. And that is not going to happen until we have fully developed all of the measures that we need to be able to truly tackle this in an ongoing way and in a method that is going to see us through until such time as we have a vaccine. I want to talk for just a minute about a couple of the things that are guiding a lot of our actions here at the county as we go into this mindset of preparedness. The first relates to general metrics related to opening and closing. We've seen guidance from the federal government around the ability to move into what they deem as phase one. We know that we're likely to get additional guidance from the state of California, perhaps as early as tomorrow, about what they see as those key measurements. We will take those, the federal ones and the state ones. We will assess our situation locally, and then we'll be able to begin to convey to you exactly what it is we need to see that triggers the ability to do easing, what it is that triggers the requirement to stop or pause where we are, and what it is that would trigger the requirement for us to turn the dial back. These metrics are likely to be continually refined, continually enhanced, perhaps continually changed, but we will always tell you what we are measuring, what it tells us, and why, and then if it changes, we will explain that. Right now, we are presently spending a lot of energy and effort talking about the percentage of testing that is positive, because that is not only a federal indicator, we think that that is a more appropriate reflection of where we are as a community than just the raw number of positive tests. Right now, we are also spending a lot of time focusing on the impact on our healthcare system, both from COVID, but from everything else, because that tells us a lot about where we are in relation to critical capacity or critical point at which our healthcare system becomes overly taxed and overly strained, because we think that is an important indicator. And so we're going to continue to refine those to identify, again, what is that green light that may say go, what is the yellow that may say pause, what is the red that says stop and go back, and we will continue to work through that both with the state and federal government. The second area is around testing, tracing, and treatment. We know there's been a lot of discussion around testing, and we know that that will continue. But it is really important to recognize that it is not just the testing that is an indicator of our ability to begin to move forward. It is all three of them together. There has to be a robust system in place of daily testing capacity. If we can rapidly identify every positive case through robust, available, accessible testing, we can ensure that that person gets the results, that they isolate, and it does not spread. Then very rapidly, we have to track down every person that person has been in contact with, talk to them, offer them testing, assess them for symptoms. That is the tracing. And we'll have to contact these folks multiple times over periods of time. This is something that is a cornerstone. It is a hallmark of public health and infectious disease. It is something that we do very well, but we have to do on a scope and scale the likes of which we have never imagined. And we will meet this challenge, and we will do this. And then the third piece of that is the appropriate treatment and isolation for those individuals who test positive. If they don't have the ability to isolate at home, they don't have a home environment that allows it, then we have to make sure that we have the capacity to meet those needs. Again, this is a system that is not just going to be in place for the next month. This is a system that will be in place for the duration of our coronavirus exposure until such time as we have a vaccine or wide-scale therapeutic treatment. It is what we have to do on a daily basis and what we need in order to be able to mitigate and move forward. We've talked about beaches. I want to reiterate about parks for a second. Each individual city and jurisdiction has the ability to have their parks open if they choose. Some have chosen to have them open, some have chosen not to. But there are countywide restrictions around parks that are in place to this day. Those countywide restrictions relate to parking lots being closed, parks only available for passive activities. You can walk, run, or bike, but you can't sit and stop. You can't play sports. You can't do things like that. And cities have to be able to physically distance. As we consider lifting some of those countywide restrictions, we are working with local jurisdictions. We are asking them to come up with their plans and their protocols for how they will do mandatory signs, for how they will protect the health of those who are there, how they will enforce it, how they will have proper staffing, all of those types of things. Again, we've outlined we would like to lift the countywide restrictions on parks in part, perhaps as early as May 1st, but we are working with local jurisdictions, encouraging them to develop their plans and design their plans around that. And then as Supervisor Cox mentioned on Friday, we announced mandatory face coverings, and this is another part of us as a region adapting to the new normal. We believe face coverings are going to be a part of our way of life moving forward for the foreseeable future. We'd had a strong recommendation that individuals utilize a face covering when you leave your home, and it's become clear that it's time for this to move beyond just a strong recommendation into something that each and every one of us do. We've seen some cities move forward with this being a requirement, and we think that that action made sense, and it made enough sense that we should expand it countywide. We are putting May 1st as an implementation date just to give folks a little bit of time to track down a mask or a face covering, but that is only 4 days away, and I think that most San Diegans are complying with this already, and to those San Diegans, we say thank you. Your actions are not only protecting yourself and others, but as we move forward to the Friday deadline, we want to encourage all San Diegans to ensure that when you leave your house, you have a face covering. The order says when you come in within 6 feet of someone who's not a household member, you should have your face covered. The easiest way to do that is when you leave your house, have it with you and cover your face. If you find yourself all isolated, alone, not anywhere near anyone else, then common sense would apply. But the aim is to prevent the spread and transmission of coronavirus, and the aim is for us as a region, again, to continue to prepare both mentally and as a way of practice of the types of things that we're likely to see for the foreseeable future. With that, I want to give a quick update on the homeless shelter testing. The number of tests administered is 663. That is 458 residents and 205 staff. Out of those, as we announced this weekend, 2 have tested positive. Both of those individuals are moving into county public health rooms. 644 have tested negative. 17 test results are pending. The testing is resuming this week, and we will get to universal testing where every resident of the convention center will receive a test and will take a test moving forward. With that, I'm going to jump into our charts for today. The first one shows 98 new positive cases out of 823 positive. This is a 12% positive rate. 12% is higher than what we've been trending on average. This is obviously as we look at these percentages, we are going to see day-to-day fluctuations in the percentages. And what you see in the purple line there is the rolling percentage positive on a 14-day time period. This rolling average is more important to us than the day-to-day totals, but we would like to see these percentages continue to trend in a negative or at least flat direction. And so we will continue to monitor and watch with great interest the day-to-day percentages. You also will note the day-to-day variations in testing. That has been true since the beginning of this. We would like to see that begin to increase in a steady way as we increase the number of actual tests being conducted, but we will continue to monitor that. The second chart here, I want to point out a slight change. The total bed capacity on the top is the licensed bed capacity. This is the licensed bed capacity for our healthcare system, but not every licensed bed is an equipped and staffed bed in San Diego County. And so the more accurate reflection is the purple line you see there, which is current bed capacity. Those are beds that are available, that are staffed, that are equipped, that are ready for patients. And there you can see that today we are reporting 363 COVID-related patients in our area's hospital systems. Brings us to a total of 3,295 beds. The blue being non-COVID patients who are utilizing a bed, and the orange being COVID patients. And again, you can see a relatively flat line across this chart going all the way back to the beginning of April. And that is an encouraging trend, an encouraging sign. The last chart has the cumulative totals, which again are less, tell us less than the percentage of positives, but you do see the doubling rate of positives there every 17 days. The estimated number of recoveries. The hospitalizations is cumulative. On the previous chart, you can see the current hospitalizations, but there you see the doubling rate of hospitalizations at every 26 days. That is an encouraging number. ICUs at 36, and the unfortunate loss of life at 113, which is a doubling rate of every 21 days. With that, I would like to turn it over to Dr. Wilma Wooten for her Public Health Officer's report.